Nutrients for rheumatoid arthritis? There are at least 8 nutrients that impact rheumatoid arthritis risk and disease severity. So for this video, let's focus in on 3 of them. Let's look at vitamin D, conjugated linoleic acid, and coenzyme Q10. Low vitamin D levels increase risk of autoimmune disease in general, and rheumatoid arthritis is no exception. And for example, in a 2012 study, individuals who had the highest vitamin D intake had a 24% lower risk of developing rheumatoid arthritis compared to those with a lower vitamin D intake. There are a couple of small clinical trials that show that conjugated linoleic acid can reduce inflammation and improve symptoms in people with rheumatoid arthritis. Like a 2014 clinical trial that combined conjugated linoleic acid with vitamin E and showed lower markers of inflammation, and a 2016 clinical trial that showed that a conjugated linoleic acid supplement had a positive effect on markers like osteocalcin, IGF-1, and telopeptides C. And coenzyme Q10 is another nutrient that seems to lower disease severity. For example, in a 2019 randomized control clinical trial, 2 months of a coenzyme Q10 supplement reduced the elevation of a marker of disease activity called metalloproteinase 3, while also reducing patients' pain scores, tender joint count, and erythrocyte sedimentation rate. Now, I know it's tempting to hear about these 3 nutrients and want to run out and buy supplements, but remember that nutrition is not the only risk factor for rheumatoid arthritis or the only factor affecting disease severity, and that this is just 3 out of at least 8 nutrients that impact our risk and disease severity. And that's why Nutrivore is such an important dietary concept. The goal of Nutrivore is to get all of the nutrients our bodies need from the foods we eat, ideally without engaging in a restrictive diet mindset so it becomes a sustainable habit. And if that sounds good to you, I recommend grabbing a copy of my book, Nutrivore. It has everything you need to learn the ins and outs of sustainable nutrition.